We'll do the Pledge of Allegiance. John Cusack will lead us. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ms. Zimba, would you do the roll call, please?
Mr. Brown? Mr. Kuzic?
Here.
Mr. Giovanni?
Here.
Mr. Gofredo?
Here.
Mr. Heckman?
Here.
Mr. Lott?
Here.
Mr. Myers?
Present.
Ms. Fargo Hefner?
Present.
Ms. Zirinsky? Here. All present except Mr. Brown, and Mr. Lott is on the phone.
Ask for a motion to approve the minutes from December 8th and January 3rd.
Motion.
Second.
Second.
Call. Votes by acclamation. All those in favor say aye.
Aye. Aye.
Courtesy of the floor, we have no one who signed in. If there's anyone who would like to, here's the time too. You can come up, tell us your name and where you're from, and we'll move on from there. If not, we'll move on. Mr. Executive, do you have a report?
Good evening, Council. It is no doubt in my mind that we together have the best interests of our employees, and we together will work to make sure our bottom line is as fiscally sound as it possibly can be. And in that context, tonight during my report, I wanted to talk a little bit about where we are with the Partnership Health Center. And I thought it was timely because there's an override resolution on the agenda tonight specific to the Partnership Health Center. So I thought that it might be beneficial not only to us here in the room, but to the broader viewing audience on YouTube as to where we've been and where we've gotten to on this process, collaborating together, specifically the engagement of certain members of County Council has actually allowed us to move our understanding of just how good this would be for our employees and for our bottom line forward. And I think as we go through this tonight, we'll see that. And
Hi, Linda. This is John Brown calling in.
there he is.
Awesome.
And so Mr. Dirtinger's going to pass this PowerPoint out, so you'll have it in front of you. Is it the first one? Thank you. So first, I think establishing the timeline is important because the establishment of a Partnership Health Center, I think as our investigation has revealed, although we now know how beneficial it will be to our employees and how good it will be for our bottom line, it takes a lot of work to get there, right? And so Integrity Health was here to present to the Finance Committee on August 17th, 2022 for 1 hour and 15 minutes. And one of the things that council many years ago did that I think was sagacious, although I didn't support it at the time, was to begin to record their meetings, which ultimately led, as technology brought us to this point during the pandemic, to put this on YouTube. So anyone who wants to go back to the council meeting on the 17th to watch that hour and 15-minute presentation from Doug Forrester, Chairman and CEO, Mark Calaguire, Vice President of Government Relations and Client Development, and most importantly, Dr. Joseph Calabro, the Chief Physician, they can go back there on YouTube and watch that. If we move ahead to the next slide, we see Integrity was back in October. And on October 19th, 2022, they were here for 50 minutes at the Finance Committee meeting. And Doug and Mark were back. And this time they brought Judy Lagana, Chief Clinical Officer and Senior Vice President. And again, I encourage anybody within the sound of my voice to go listen to that YouTube meeting to see all of the work that's been done, not only by Integrity and the administration, but by counsel, listening and learning and asking penetrating questions, us working together to bring this great benefit to our bottom line and to our employees. One of the things I want to talk about, in a minute I'm going to play a video, and it's not just for our benefit here, but for the benefit of everyone who pays attention to what we do. And, you know, there are three or four people who do that. We're going to hear a testimonial from Michael Salvatore. And I want to tell you a little bit about him, and if you want to get that up while I do this. I think this microphone is powerful enough to pick up my voice. From the Asbury Park Press on October 30th, 2020. And I'm talking about this newspaper article because I want to make the point that Dr. Salvatore is not just a guy, okay? Dr. Salvatore is now at Kane University, where he is the Senior Vice President for Administration. Before that, Dr. Salvatore began his career in the district, first as a student teacher at Gregory School in 1996, and then he was hired full-time in 1998. In 2001, he was promoted to Gregory School Principal. In 2010, he was named Assistant Superintendent before becoming Superintendent the following year. And as Dr. Salvatore, the man you'll hear from in a moment, was leaving, this is what his board president said. I watched him climb the ladder of success. He's always been very energetic. We're going to miss him, the board president, Donald Coven, said. The kids are going to miss him because he was always a hands-on superintendent. I selfishly told him I didn't want him to go. We wish him and his family nothing but the best. Now we have to find someone who can fill his shoes. Finally, in the article, we learned that Dr. Salvatore oversaw as superintendent before he went to help run Kane University, oversaw one of the largest districts in Monmouth County with 9 schools and nearly 6,000 students. And this is what he had to say about Integrity's partnership health centers.
I'm Mike Salvatore. I've worked in education for nearly 25 years as a teacher, principal, and superintendent of schools for nearly a decade. During my first budget cycle, I remember being presented with a raft of obstacles. You can't increase property taxes. Oh, be careful because labor negotiations is very high, and utilities and energy costs are through the roof. So there's only one solution, and the solution was to reduce. It was a subtraction model. Reduce faculty, reduce services, reduce staff. And I thought, but we also reduce quality. In the day and age in health and wellness, we're talking about social emotional learning, to put more burden on the backs of teachers and children just certainly wasn't fair. We started to look to take control of our own destiny, and we evaluated all of our major cost centers. And that's what's brought us to Integrity Health, because we narrowed down to health benefits. Integrity Health helped us build a partnership health center on our campus. It was a medical home that our employees took to in droves. At one point, we had more than 500 visits a month on average. What I loved about this model, because regardless of your title, degree earned, your income, they had the same concierge type service as everybody else. No waiting lines, no copays. We did a fabulous job that first year. Care coordination was the difference maker. Having the staff from the Partnership Health Center communicate with medical professionals to avoid unnecessary appointments and procedures, our staff benefited tremendously, and we had major savings from that. The following year, we collected enough information that we started to add more to our medical services. Because what we realized was educators or people who take care of other people, sometimes they leave themselves behind. And we want to make sure that they had the care that they deserved. We started to offer a wide array of medical services, including chiropractic, physical therapy. We had x-ray technicians on site. We even had acupuncture and free yoga sessions. Our goal of fiscal sustainability was accomplished, but more importantly, we were taking care of our people, and you can too.
Thank you. So, survey results of our employees with respect to an on-site health center. I know we've discussed this before, but I thought it was important to revisit it in this context. And I know there was some controversy and enough to make it into that ordinance that we're talking about tonight, about whether the survey we did and the results we got were representative of our employees' thinking. And so I think it's important to put it in context. And let's take politics, something that most of us here are familiar with. In a presidential race, when they do a national poll, they release results with about 1,000 completes. That's 1,000 people across the entire nation of over 330 million people. They use 1,000 completes, and they get pretty good results. And that's math, right? In a statewide race, they got about 500 results for, say, a Senate race. And locally, I've seen as few as 300 completes with respect to congressional races. So it's sort of math, but let me talk about our survey. So I went to research survey sampling and found out what was important about survey sampling. And there's a couple of things that are important. One is, what is your confidence index? At what percentage can you be confident that your results are representative of what people are thinking? And that confidence level is usually 95%. And then you can typically see a margin of error of plus or minus 5 percentage points. And that means that the results you get could either be 5% higher than what you have or 5% lower, but there's a 95% confidence level that you are within 5% of those results that you produce. So what did we do? We sent out our survey to approximately 1,700 of our employees, and we received 481 responses. Now, I went on the internet to calculator.net and went to their sample to see if I had a statistically significant sample. And what I learned was, from calculator.net, was that of our 1,700 employees that we surveyed, we only needed to have 314 employees respond to have a 5% margin of error at a 95% confidence level. In our survey, we got 481 responses. So I understand it's math, but it is, what are you laughing at? It's math, right? Am I wrong? It's math. Okay, thank you. So we have more responses than we need to have a 95% confidence level at plus or minus 5 points. And I thought that was important to point out because I think there was some confusion about our sampling. So let's look at some of the questions again. Would you use an on-site or near-site health center that is run by a third party offered exclusively to county employees and their insured dependents? 78% of our employees said yes. And remember, that's plus or minus 5. So that could be well into the 80s. But it's still in the 70s of our employees who think this is a good idea. And one of the things we've been talking about throughout this process is, what do the employees want? Clearly, they think this is a good idea. And we talked with them about some other things. When would you use it? I mean, I think that usage is sort of probably consistent with how people go to the doctor now, right? We asked what would they prefer, on-site, near-site, and we got our answers there. We said, who would you go see? Physician, physician's assistant, we got our answers there. And then we asked, and I think it's worth a minute or two for us to reflect upon this one. Would you visit the health center if it wasn't affiliated with one of our 2 largest networks? And they said yes, they would. And finally, we have the Steelworkers of America who have endorsed this plan, and we have AFSCME Local 1265, our single largest bargaining unit, endorsing this concept. So, when we talk about the question, so we've answered the first question, do our employees want it? And the question, I think, based on the evidence that we have, they clearly do. And as a corollary to that question is, will they use it? So if you build it, will they come? And here's Somerset County, New Jersey. And Somerset County is very similar to Northampton County in size. And this is the usage data that the utilization report that Integrity has provided to us with respect to Somerset County. And as you can see, they use it in Somerset County. So now we've answered that question. Do they want it? Yes. Will they use it? Well, the data suggests from Somerset County, a very similar county, that they will. And as I talked about earlier, so we had these 2 long meetings with Integrity in the Finance Committee meeting, and then some council members followed up with Integrity with questions. And Mr. Griffredo was one of those members, I know. Mr. Heckman was one of those members. And their questions elucidated even more evidence to the point that this not only will be good for our employees, which I think we've established, they want it, it'll be good for them, they'll use it, but that it will also be good for the bottom line with respect to our health care plan. And as we begin this phase of it, let's keep in mind that we've saved, since 2018, $2.3 million, 2.3 with telemedicine services. First with Teladoc, and now Healthiest You. So if we can save $2.3 million with telemedicine services, imagine the potential we could save with Commissioner Griffredo, he asked some really good questions. And one of the things that he asked was, he said, I sincerely appreciate the time you have taken to respond to my voicemail. In all fairness, I'm extremely conflicted about the idea of Northampton County getting into the healthcare business. Good question. And Doug Forster, who replied, agreed it was a good question. And he said, and I won't read the whole thing because that's boring, but part of this unpacking involves understanding the dynamics of the health plan as a whole. In this regard, a critical point should be made. If the county spend $24 million annually, soon to be $30 million, and it's the second largest line item in your budget after salaries, you are already, in a very real sense, in the healthcare business. And then he says, this is Forrester, he says, you pay tens of millions of dollars a year to a vendor, carrier, acting as your agent to spend your money and that of your employees for healthcare services. The Partnership Health Center initiative is exactly the same with 2 critical differences. 1, instead of providers serving the public at large, ours will be focused solely on your employees. And 2, unlike the healthcare industry, our model has no economic conflicts of interest associated with treatment or frequency of care. Then Mr. Griffredo goes on to ask another good and penetrating question. That is a variable I have a hard time estimating because there are so many variables that are still unknown to us. I fully understand I am oversimplifying a much more nuanced equation. However, we should have a line of thinking to make sense of how much we still would be spending on conventional medical services in addition to our new spending in Northco Health Department, X plus Y equals Z. And Forrester goes on to say, the ROI measurement is an actuarial assessment of the impact of all PHC services, treatments, care, coordination, et cetera, using nationally recognized population health standards, for example, Johns Hopkins, as discussed in his September memo. Independent actuaries and data analysts consider the variables you mentioned. And then Mr. Griffredo asks another good question. And, I'm glad he asked these questions because it is adding to our understanding of just how good this project will be for us. Considering the ROI savings that Integrity has estimated are based on projections of 24% increase in healthcare costs to the county, what is the Norco Health Center ROI if our overall costs only go up 20%, 15%, 10% remain the same? And then Forrester goes on to give an explanation again of ROI, but he says, For example, an ROI of 1.6 based on a partnership health center spend of $3 million would mean that the health plan would have spend net $1.8 million more on hospital and professional services claims if the partnership health center wasn't there. Depending on a variety of factors, the overall health plan spend may have gone up during the year, but in the example, it would have gone up $1.8 million more if the partnership health center weren't there to step on the brakes. So he then goes on to say, we were not aware of the planned actuary project 24% increase prior to 10/19. However, whenever there are large increases in a plan without a partnership health center present, it is likely there's a lot of low-lying fruit to capture. This would mean that an ROI could be much higher than 1.6. So what's the ROI? It's the dollar we invest plus what we get back, or what equals what we get back or what we save. So this would mean that the ROI could be much higher than 1.6. I noted in our earlier submissions that ROIs have ranged from 1.2 to 2.6. So every dollar, and the 1.2 is a pandemic low, as we'll see. Without drilling down more, he goes on to say, in Norco claims experience, likely requiring more transparency from the carrier than possible before we are under contract with the county, it wouldn't be prudent to identify more than a general ROI number or project-specific ROI tiers for various trend percentages. Suffice it to say, given the recent news about a 24% increase, I think our original ROI savings estimate is conservative. So that's really good news for us, that they can actually save us more money than that. And then we get into some of the excellent questions that I think Mr. Heckman posed. And some of those were, give us your references. Tell us, how long have you been in other places, and who can we call to figure out whether this is in the best interests of Northampton County? And he pointed out Tom's River Regional Schools, the longest client at 13 years. They renovated and expanded in 2010, and they said Superintendent Mike Sitta is the person to contact there. Somerset County's been 4.5 years, and their county administrator, Colleen Marr, or the mayor of Fanwood, New Jersey, Colleen Marr is the person to talk to there. Brick Schools, 3 years. Good example regarding value to employees of reciprocity access among PHCs, as well as assistance with a recent transition from one network to another, Horizon BCBS to Aetna. That's Superintendent Tom Farrell. Lycoming County, Commissioner Rick Murabito is someone who could be relied upon to find out what the experience has been there thus far. And Forrester also points out the state of New Jersey First Responder Program. It may be worthwhile to confer with Kristen Deacon, an attorney and health benefits expert who, until last year, managed the New Jersey State Health Benefits Plan, 880,000 lives. She has a statewide reputation as a strong public administrator and health policymaker. We worked with her to establish a PHC program open to all New Jersey first responders, those in the state health benefits plan, as well as those covered by other insurers. Her familiarity with the importance of easy access to primary care and lowering health care costs has drawn her to our model. That's a serious person. What was the ROI of each entity per year? And that was another great question that Mr. Heckman had asked. And, it's really important that council got engaged in this, because we got some really excellent answers. And one of them was, so it's a testimony to the strength of the partnership health center model that Tom's River BOA has enjoyed a substantially superior rate trend over this 10-year period. The state's, this would be the state of New Jersey, average annual rate increase has been 50% higher than that of Tom's River Board of Education. 50% higher. Can you imagine if we could achieve that here in Northampton County? It would be remarkable, not only for our employees here, but would also be terrific for our bottom line. As we know, irrespective of whatever the trend is, it's going up, whatever the percentage may be. Another great question here that Mr. Heckman asked around ROI and what we might expect. One of the answers was, however, we've used independent actuaries to make professional assessments based upon national population health benchmarks, as well as average network and out-of-network provider reimbursement patterns. The approach of ROI assessments is to develop a ratio of PHC cost to actuarial measured health plan savings. Example, a 1.5 ROI would mean a net savings equal to 50% of the cost of maintaining the partnership health center. It's starting to become a no-brainer, folks. Not only do our employees want it, it's clear that it is going to help our bottom line. And this next, for anybody that cares about good government, I mean, this sells me on it. The range of ROI calculations from these firms for various clients over the years has been from a pandemic period low of 1.2 to a high of 2.8, an annual return ranging from 20% to 180% based upon the cost of PHC operations netted against gross health plan savings attributable to PHC operations. If we do this, our ROI could bring us between 20 and 180% in savings. How do you say no to that? I don't know how you do, good conscience. So I wanted to discuss with you a little bit about what do our employees want and will they use it? I think the evidence is overwhelming that they want it and they will. I wanted to discuss with you a little bit tonight about where we are, and thanks to Mr. Griffredo and Mr. Heckman for the work they did, because we now have a much better understanding that we're going to save a ton of money from our bottom healthcare spend if we establish a partnership health center. And the third issue that I wanted to discuss was this whole notion of using the provisions in our code for sole source selection, and that's Section 1310, non-competitive negotiations. And if in fact we had a contract that I would bring to you, I would have to pen an executive order as to why I use that method. I have to demonstrate that to you. And in a minute I will, but I want to back up and make a couple points. It was never going to be a rush to judgment or a unilateral imposition of a partnership health center in Northampton County. And that's because you have to approve any contract we enter into with them, because it's going to be in excess, even though it's a service, of $100,000. So council was ultimately going to have an opportunity to consider that contract. And additionally, there would be another bite at the apple, because council would have to consider the lease that was entered into with respect to the establishment of the partnership health center. So there's that. Council's ultimate judgment was never going to be taken from council by my choice of using the non-competitive negotiations, which the administrative code permits me to do. But let me just go through why I think they are unique, why I think that this provision in the administrative code allows me to do this. Again, with your ultimate approval on at least two separate occasions, two separate votes. So what makes them unique? And this would be in my executive order when I said that I was using non-competitive selection. There's no economic conflicts of interest to compromise best practice medicine. They're not owned or operated by a hospital system, not owned or operated by a carrier, no revenue, commissions, fees, etc. Pass-through costs without markup for complete accountability, not a capitated HMO model, which can compromise care and transparency. Option of out-of-network green circle providers with direct reimbursements. No referral fees from anyone including Green Circle providers. In addition to typical primary care services, they have the largest supplemental list of on-site services integrated with a medical director. They have pharmacy, mental health, PT, chiropractic, acupuncture, exclusive focus on public sector clients like us and employees and their health plans. Health center facility providers not accessible by the public. Dedicated on-site union liaison and client relations specialist. They're not aware of any company providing such on-site primary care services, which also has experience in managing all aspects of a self-funded health plan for clients. For example, the carrier, the TPA, the PBM, the stop-loss insurance, direct contracting, and management. So, counsel, thank you for allowing me to take so much of your time tonight, because I think this is important. Starting into my 6th year now as county executive, and one of the things I'm most proud about is, to date, I have not brought a bad idea to county council. I have not asked you to, well, we don't know about that yet. I have not asked you to vote on anything that I had not thought was in not only the best interests of the taxpayers of Northampton County, which is our guiding principle, but you. I have never sought to put county council in a position that it wouldn't be doing its best for its employees and for the citizens that we all serve, which is why I took up so much of your time tonight. That concludes my report.
Are there any questions for the exec? JP?
I don't think any of us are going to claim to be experts in the field of hospitals, medical care, any of that. Would you consider yourself an expert in that industry?
I do not.
Okay. So can you justify to us as a council, because I think one of the major sticking points is that although you are allowed to forego the competitive bidding process, it doesn't leave us a very warm, fuzzy feeling in our belly knowing that this is the only company that we're being shown, and all of the information that we're basing these decisions on are coming from them, from nowhere else. How
Yeah.
are we doing our jobs if this is all we have to look at?
I understand that, and if I believed that there was a source that met all of the criteria that would return us between a 20 and 180% return on our investment, and yes, and well, based on the numbers, their experience, yes. Okay, well, I mean, you can take them at their word or not, but I would say that there is not any contrary evidence to suggest that what they're telling us isn't absolutely true. And they've given us, we just went through a slide tonight, they've given us their clients who we could contact. We saw Dr. Salvatore tonight, who's not just a guy, telling us how it worked out for him at Long Branch or wherever he was. So I think that at some point you are free to disbelieve them. You're free to disbelieve the numbers from Somerset County that they've shown us, or the ROIs that they say their other clients are
How do I
getting.
not know there's a company out there that could do better? How do I know that there's not a company out there that can do it for 1.5 instead for 3%? We don't know. And that's kind of where, I've never done this before. I've never had to rule or judge on something like this. A little bit more variety or a few more options would make us a little bit more comfortable, especially if we're hesitant on it.
And I understand that. And if I believed that, and I believe you'll see evidence in the very near future to make this point, if I believe there were companies out there that would check all the boxes that integrity checks and provide us the services that they provide and the potential savings to our health plan that they have indicated that they can save for us, I would have done that, but I don't. Thank you. You're welcome.
Tara? I thought you did. Anybody else? Thank you, Mr. Executive. Okay, old business, public hearing on the ordinance entitled an ordinance of the County Council of Northampton County authorizing the purchase of lands situated at 3502 Kesselville Road, Forks Township, Pennsylvania, from James Dietzler and Christine Dietzler, his wife. It was introduced by Ms. Zirinsky and myself. Are there any questions or comments? Yeah. Call for the vote.
Don't we need a public hearing?
Yeah, he's asking if there's any questions or comments.
Questions, comments on it?
Okay, well then, I've noticed we have some high school students here, and I'd appreciate if maybe somebody from the Economic Development Office could explain what exactly we're voting on, so they have something to report to their teacher, just briefly.
Teachable moment.
Always an educator.
Teachable moment.
Sure. So we are acquiring this property to fulfill our plan with Habitat of Humanity for the Lehigh Valley for an affordable housing project that we're doing that's going to net 55 to 60 homes in Forks Township.
Thank you.
You're welcome.
We're at in Forks, Tina. That's a big area.
It sits right behind the 2Ts, mini golf off of Sullivan's Trail 115. It's green space right now, open land.
Thank you.
You're welcome.
Is there any further discussion? No other comment? Ms. Lindberg, I'm going to call for the vote.
Ms. Zirinsky.
Yes.
Mr. Myers.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lott.
Yes.
Ms. Fargo Hefner. Yes. Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Ordinance is adopted by a vote of 9-0.
Is there any other old business that we need to discuss? If not, we'll move on to new business. Introduction of an ordinance entitled, "An Ordinance of the Northampton County Council authorizing the County of Northampton, Eastern Pennsylvania to lease approximately 2,400 rentable square feet of space at 31C West First Street in Wind Gap, Pennsylvania from Joseph DePue. Ask someone, I need someone to sponsor it.
I'll sponsor.
Okay.
John Brown.
We have Mr. Brown and we have Mr. Giovanni. We will have a public hearing on that January 19th meeting, 2023. There's a consideration of a resolution overriding the county exec's veto of the ordinance entitled, "An Ordinance Regarding an Employee Health Center Funded by Spending from the 2023 Proposed and Adopted Budget." Mr. Gofredo, would you read that for us, please?
Whereas at the meeting held December 1st, 2022, the Northampton County Council duly adopted the ordinance titled, "An Ordinance Regarding an Employee Health Center Funded by Spending from the 2023 Proposed and Adopted Budget." Whereas the duly adopted ordinance was presented to the county executive December 2nd, 2022. And whereas on December 9th, 2022, the county executive vetoed the ordinance, a copy of the veto message is attached, and returned it to the county council. Now therefore be it resolved by the Northampton County Council that the county executives veto the ordinance titled, "An Ordinance Regarding an Employee Health Center Funded by Spending from the 2023 Proposed and Adopted Budget shall be overridden this 5th day of January 2023.
All right, at this point, is there any discussion on this? Mr. Brown, Mr. Cusack.
Yeah, couple things. First of all, I'd just like to say, I agree with the county executive that this could be a good thing for our employees. I haven't agreed with his math. I think the employees would be in favor of it. But I've been pretty consistent on this issue. To me, the problem I have is the failure to go through a competitive bidding process. Now, I know the executive explained his reasoning, and I can understand how he came to that conclusion, but as I read Section 310, it says that this should be used when the county executive or his designee determines that it is not practical or prudent to use a method other than this one. And I would submit to you that it is practical because there's another county that has done this. So I could see myself supporting this if it went through a competitive bidding process as it has in another county. And lastly, in section 1310 of the code, it says, this method should not be used to substitute for a competitive procedure if a competitive procedure can reasonably be used. I believe we can reasonably use a competitive bidding procedure for this facility. Now, we already do bid out healthcare for our jail inmates. We've done it before. Is it comparable? No. I mean, that's a captive audience, and they have no place else to go. But we do bid out healthcare in another place in this county. So I believe it can be done, and, you know, the other thing that, I don't know how some of you feel, but to give government employees quote-unquote concierge medicine, to some people in the public, that may be a little concerning. Well, you know, I have to wait in line or I have to sit. I mean, it's great for employees. I'm sure they'll be in favor of it. But ultimately, for me, I need to see this done through some sort of competitive bidding process, and I believe it is practical. It can be done prudently. Will we get every single thing that's listed? I don't know, but I think we can get by without free yoga. So if I were to have this in front of me to vote yes or no as part of a competitive bidding process, I could see myself supporting it. But I think the method, while I understand, you know, Mr. McClure's argument, I respectfully disagree with it, and I would prefer to see a competitive bidding process. Thank you.
Anyone else? Ms. Zavinsky?
I think for too long, we've neglected, not necessarily in the county, but healthcare as a topic. I think people's access to healthcare is really compromised, and although that we are surrounded by hospitals everywhere, it seems, that doesn't necessarily mean we still have good access. If you've been to an ER lately, like I have, you'll know that there's long lines, there's waiting. And to say that, you know, why should our employees get better treatment than the public is not an excuse or a reason not to agree for this, because we should hope and wish that for everybody. What we can do is what it is in our power to do. And so this is in our capability of power to do. We can improve the healthcare and access for individuals in the county, in our employ. And I think that we should definitely try to do that. And we can do that. And in that statement that you made about 1310, when a document says can, it means you're able to, maybe. It doesn't say shall, it doesn't say should. It says you can. There are not that many competitors coming here and offering these services. And regardless of whether you think that there is a benefit to yoga or not, I could tell you there definitely is. And I could tell you that if there was access to yoga, regardless of whether it was free or an expense, the other care that is offered to them is 20 to 180% to our benefit. We are going to benefit not only now, but in the future. And the longevity of our employees are going to benefit from this as well, because this is going to create stability. You want to give people, individuals at Graysdale, tuition reimbursement. Give our county employees health care and access to quality. That's what I think we should be doing too, and I think that will help with retention and benefits. Thank you.
John Paul?
I have to respectfully disagree with the premise that we should offer our employees the type of health care that we see as, what we should be shooting for. I like the thinking that our government benefits should reflect what the market is offering the average person, because the average person, the taxpayer, is the one that has to pay for this. And I understand the projections are going to say we're going to save money, but if I was trying to sell something to a county, I wouldn't be saying you're going to spend more money on it. Of course I would say you're going to save money. Have yet to explain that and show that to me in a detailed manner where that's convincing, and I'll obviously still be looking for that. But as far as why the healthcare industry in this area is so overridden, it's not because of a lack of service or good services. It's because we are increasingly unhealthier. Every single year, we go by and we see more and more people completely disregarding their health. Why don't we talk about not serving soda in the cafeteria downstairs? That'll probably make a lot of people upset, but it'll probably help make people healthier. But having a healthcare center here is not going to make people healthier. It's just going to get them more healthcare access. But we're not having any real hard conversations about getting healthier, doing anything to make ourselves. Yoga is not going to make people healthier. It's going to be another access service that they're going to use at the taxpayer's expense. I want to see the survey go to the taxpayer and see if they really support it. Because I guarantee you, I've talked to many people. Most people have no idea what we do here. Most people don't know who any of us are if you go around the county and ask. But if you ask them if, hey, do you think we should open up a health center for just county employees and their families, and it's free to them, and you pay for it, they will tell you that they're not excited about that idea. That I feel very confident about.
I'll go around.
I just wanted to rebut.
Okay.
So I just want to say, I don't know, John, if you've never had or not had insurance. I'm an individual who hasn't had insurance on and off for years. Do you know what it's like to have to decide whether or not you're going to go to the doctor or not, or whether or not you can afford medication, or whether or not you can have a trip to the ER? I think that we should set the standard. And I think that we should be groundbreaking pioneers in how healthcare is administered in the county and accessed. I've been to an ER lately. I've had to pay co-pays. I've had to go without insurance at times. And I want to tell you, if I had access to healthcare and I knew that I had a designated doctor to go to all the time, I think that not only my health would improve, but anybody who's in that same situation would improve, because they would have access to consistent treatment. And if you want to talk about mental health treatment, because I know that was one of Mr. Heckman's concerns, having access to consistent mental health treatment facilities, to consistent therapy, to consistent access to medication is extremely important for people's mental health. And that is something that we should definitely be concerned about in this county.
Right? They have those access. They have health insurance. They have, you can swing a dead cat around this town and hit 4 hospitals at the same time. They have these things. We're offering now another thing, another option. Somehow it's going to be miraculously free to do, or we're going to get paid to do it. And that's where I'm still debating. I don't know how that's a possibility. And with a nearly $600 million budget, it's really easy to hide where things get spent. But we're adding something, an extra option, and we're going to keep everything we still have. So we're still going to have to pay for the people that want to go to the hospital and go to a doctor that's not related to their way they go to work. This is a luxury that we're asking other people to pay for. And we're acting extremely entitled to the idea that, yeah, we should give the model health care, but who's paying for it? Not us.
Okay, so Mr. Heckman.
Thank you. First of all, I completely disagree with this idea being framed. I just thought we were coming in to vote on this ordinance, overriding it or not. So I have done a lot, and I'm not done yet. So first, number one, this ordinance isn't going to kill anything. It really doesn't. I mean, I read actually reading the resolution, the ordinance and reading Mr. McClure's answers, and I've even spoken to other council members, they know how I feel. I think a fair amount of this, we can ask the employees to do it, they don't have to do it. So a lot of this is, I agree, the executive's right at this point. That's why I say this is a wake-up call to look at our charter. It's a 50-year-old document. There's holes in it. Last night, the executive mentioned things. Reasonable people can disagree. If you have 5 lawyers in the room, you might get 5 opinions. So the thing is, that's why, the charter has holes you could drive a truck through. And we should probably look at that. But I do agree, at this moment, he has the right, under 1310, to do this. Whether he should or shouldn't, that's for he and his cabinet to discuss. We really come down, and I don't think it's a bad idea. Let me just refresh your memories. I said this at one meeting. Lycoming County did this, and they picked integrity. They had integrity, work partners, Marathon Health, Care Team, Activate Health, Care ATC Incorporated, and Health Stat. Those are the people that responded to their RFPs. So it could be done, and we could just eliminate Lehigh Valley Health and St. Luke's right out of the gate because of conflict of interest, and we have things with them. So we could do that. Again, the other thing was we request for a proposal. It's a request. It's not telling him what he must do. Disclose all facts. We're going to go in circles on that. For example, the executive gave a good presentation, and I don't disagree that the company wants to do good by us. I mean, I have dealt with many contracts over the years with nonprofits, and they all come in the door saying, we're going to do it better than the next guy, and we care about your people. But then I had to have my fiscal director come in and say, well, show me the bottom line. And, I know they're name dropping lots of actuaries, but yet every question and everything I've gotten back, it's almost like I'm reading the Bible with this 1.8. I mean, that's a bold statement. We're going to return $1.80 on every dollar you spend, up to $2.60 on every dollar you spend. But we can't give you that in factual numbers because there's a whole lot of soft science that goes into it. So that, so we come down to the real meat of it, the therefores shall be considered after a full, again, don't have to do it. Survey of employees, they don't have to do it. Shall comply with the terms of the ordinance, that's boilerplate. Conflicting with provisions of this ordinance are repealed, that's boilerplate. The one that I hit is the last one, which to me has weight, and the only one I'm really that concerned about, and that is the administration is prohibited from transferring any monies from 2023 fiscal budget of Northampton County for an employee health center prior to review and approval by Northampton County Council. I would take that to mean any monies for anything, not just the building. And Mr. McClure answered that the budget isn't an ordinance in and of itself. The ordinance may have weight. But basically, we're talking about 2023. It does not exist at the time this was put, and therefore rendering this section unenforceable because it binds future council. Well, now we're in 2023, so we can, in fact, do it. I think some of this has been bogged down in a lot of legalese and a lot of who cares and who doesn't. I don't have a problem with the employees getting better, more service, because I'm convinced they're going to get better, but they're going to get more service. The only numbers I've seen are, God bless them, from Mr. Barron, from our financial committee meeting in August, which I've reviewed the notes numerous times. Excuse me, numerous times. Mr. Barron once stated if he went to patient first, the visit would cost him $500. If he went to a doctor already on staff that could take care of him during the hours they were available, it would cost $250. So he further stated right now they are just bringing the concept to them. So I'm taking it with his example that he's showing an example where we pay, I don't know what we're paying them at this point, but we pay them $500 per visit. And I assume the copay is $10. So we're paying them $490. But if they go to this new place, Infinity, the county will only be charged $250 and the employee won't be charged anything. I haven't had them come forward and confirm that. I haven't had them confirm that in the paper. All I've gotten is 1.8 to 2.2 guaranteed. I ask if we could please, since these plans cover 14 years, 13 years, 8 years, 4.5, I have to believe, and as somebody who's had to look at these reports in the private sector and in government, at some point, the CFO or the fiscal manager is going to say, this is all wonderful, our employees like it, it's great. Show me how this has saved us money. Those numbers exist. Now, maybe they need the permission of the client, then get it. You're asking us to invest millions and millions of dollars. My other concern is, and we're not voting on this tonight. I'm in favor of the concept, but this ordinance to me has nothing to do with, I won't know anything until I see a contract, because the paperwork I get back pretty much says, it's up to the client, it's up to the client, write it in the contract. So nothing really means much to me until I see a contract in front of me. That's the vote that matters. So I just think that, one, we could get real numbers. Do I want to see the employees have more access and the idea they don't have to pay the copay? Sure, anything that'll help them. That's why I fully support a pay study. And I'm sure the union reps will come in and support us when it comes onto the table. That yes, council, do the pay study and do it for all employees. Because we do vote on wages. So that is something we do, and it's in the charter. So I do have permission, I think, to look at something. So the thing is, tonight I'm not voting on doing this or not doing this. I don't think there's anything in this ordinance that stops the administration from pursuing this. In fact, the 1310 that the executive quotes is the very reason he doesn't need our permission. I mean, he can seek it, but say, God bless you, go ahead and look into things, and when you have a contract, that's what we really vote on. So, yeah, this is all employee, let's be honest with us, this is going to depend on the employees. Since we're not forcing them, and by the way, I've had employees talk to me, when you've been around a long time, not only do you get arthritis, but you also get to know a lot of people who will talk to you. And by the way, I agree with you on yoga. My wife and I had taken yoga some years ago. Now I'll only do it in the privacy of my home. But it is great when you're getting older to loosen yourself up. And and the tight people in politics should definitely do yoga. But anyway, the thing is, I would say this: it's employee driven. If enough employees use this, it probably would make sense. But we're not demanding, and that's a fear they have. They have a fear that, and I saw this in the early 80s when companies found out about HMOs. That's great, because they're going to save them a ton of money. And some of them did, because your primary physician, you couldn't go anywhere unless your primary said go. And I know my wife had a very tough time with that when she wanted to see one of her specialized doctors. And this guy who was assigned as our primary said, no, I can do it. So I said, no, you go where you go, and we'll just pay out of pocket. So I think this is somewhat modeled on that, but we're not forcing them. And I think there's a fear people have expressed to me that there's going to come a time, and I've said this before, and I said I don't believe Mr. McClure would do this. But once we have this is a big step. This is the biggest step, I think, since 911 Center. This isn't like, oh, here's some land, or here's a building, we get a lease, or he wants to buy it. Once you invest in this, we're going to keep this for a long time. It's the only way it makes sense. So if they buy into it, they buy into it. If they don't, it's going to be a problem. I don't know if the $10 is worth them. I understand why they want to talk about the location. I get that. But I found a lot of people work on convenience. If it's convenient to them, they'll do it. If it's not convenient for $10, maybe they won't. We have a robust health system in the valley. We're blessed in some ways, competitive. But I don't know. So I'm not against this plan overall. We're still going to be paying Blue Cross and Blue Shield. If this isn't used enough, we could just be doubling our costs. I mean, again, they're telling me this is what's happened. I've said, okay, great. You've been here 14 years. You've been here 13 years. Give me some meat on the bone, some numbers, release some numbers. Redact the name of the place. I don't care. No, well, see, here's the thing. They're going to be better. Everybody's going to be happy. Life is going to increase. In planning, they'll do a medical plan. That's employee dependent. In the past, I'm sure your doctors sat down with you. I have a primary physician I go to, and he's often said, Ron, I want you to do A, B, C, D, E, and they have a guy call. And most of the time I blew it off because I just didn't feel like dealing. I didn't want to follow a plan. So we can't, as an executive said with surveys, you can't force them to do that. You can't force employees to do what a doctor or some company says to do. So again, don't have a problem with the ordinance because no offense to anybody, but I don't think it's enforceable in some areas. Nor do I think the discussion council's having is partisan. That's been brought up to me. I've had many discussions with Mr. Giovanni, and the discussions we have, I don't think partisanship comes into it at all. So if you're selling partisanship overall, don't sell it to me. I've been around long enough when I can pick up on partisanship. So the thing is, I don't have the same concerns Mr. Cusick has with bidding. I don't think it's a bad idea to bid it out, but Mr. McClure is right. You can do this. I do agree with the financial part of it, and I would await the contract. So that's my position.
Anybody on the telephone want to speak at this time?
Yes, I would. Thank you, Mr. President. I appreciate that. Just a couple comments. I did ask for numbers, and I was told by the administration it would be a burden on our employees to generate those numbers. So I did ask for numbers. So, that integrity provided, and I'm talking about the fine detail from the three examples.
John, can you speak closer to your phone? You're fading out.
All right, hold on. Is that better?
Yeah, it's better.
Okay, great. I apologize. I went into the numbers that Integrity provided into the school district, into Somerset County, and the other example that they provided. I took the three main examples in great detail. And what I came away with, and I did discuss this with Integrity, and they agreed, probably 80% of posed by this healthcare partnership is already provided for in the plan that we offer our employees today. 80% of it. Coordination of care, that's a kind of a premium. And member services, which when I inquired what that was, that's helping the employees with their billing and issues with dealing with their medical expenses overall. So basically 80% of what employees already have is in the plan as it is today. So really coordination of care is the premium, member services is premium that the partnership would provide. Now, if you go back, and the executive didn't discuss this part, there was a plan when I was executive in place. We went through this exercise. I agree that coordinated Integrity Health would analyze our claims and help negotiate with Capital Blue. That was done before. We can manage the pharmacy. That'd be a huge savings. We can do that before. When we did it for $30,000 or $50,000 with a consultant, which I laughed at the time. But if you go back and look at the numbers, it flatlined our increase in healthcare for several years, minimized it. So what's really going on is going down this partnership health plan program is really you're going to spend $4 million in order to provide coordination of care and member services, which would be something that I don't know how to provide that otherwise. So I think it's something that could be done. My issue is not necessarily with Integrity Health, but I think the part of the ROI could be returned without having to spend $4 million. And I haven't heard the administration taking any steps along that way. They made changes to the plan that was in place with our employees back in 2018 or 19. That opened the door to some of this exorbitant increases in care cost over the last several years, which now adds to a compounded 24%. So the challenge I have is there's not enough meat on this bone to go, well, we're already providing these services to our employees with our current plan. What is really the value add on top of that? The ROI calculated, you could probably get a big chunk of that for far less money if the administration were willing to do that. Obviously, the floor here is no more copay from our employees. The averaging plan that I looked into between the unions and so on and so forth, the average employee probably pays about 3% of their salary out of pocket to be in the plan, and then whatever their minimal minor co-pays up to a cap. I think the caps are like $400 out of pocket or something like that. So it is a premium plan as it is, and I think there's other ways of getting at this, or at least evaluating it before we jump right into something like this healthcare proposal on the table. We got other issues that I think we should be addressing. I think this is just one that's it needs to be addressed, but I think there's other ways of skinning this cat. So thank you for your time.
Mr. Lott, do you have anything to add to this?
No, I believe we covered it. Other than the fact that I think, you know, we talk a lot about, you know, trying to recruit and hang on to our employees. We touched on that. I think that would be a big help for our employees. But the bottom line is, if we don't start getting creative with our health care costs, and this is everybody out there, this isn't the county, this is something we struggled with in the union when I used to be involved with our health care there. Yeah, there's only a couple things that can really happen. We can do what the past administration did, is cut benefits to try to control our costs. We can raise taxes on our people with, you know, I talk to our residents too, and none of them will say, yeah, that's a good idea, let's raise taxes. None of them think it's a good idea. Most of them don't think it's a good idea to take benefits from our employees. We're having a hard enough time keeping employees. So, you know, the fact that, you know, getting creative here and looking at other options, and what I appreciate Mr. Heckman, he says that this ordinance resolution doesn't have teeth. Then I kind of wonder why we're doing it. You know, and I hear people saying, you know, this is a good idea, but, you know, we're going to do a resolution that says don't do it. So I'm not quite sure where we're going, because I heard a couple people on this council acknowledge that there's going to be issues with our finances if we don't get this under control. But yet nobody really wants to, you know, go out there and say, yes, let's investigate this. And I think Mr. Heckman hit it again too. I mean, we have to approve the contract. We have to approve the leases, you know. So I don't know if this is just, you know, gamesmanship, but if this ordinance and resolution, as Mr. Heckman states, really doesn't have much teeth to it, you know, what are we doing there? And that's about all my thoughts are. Thank you.
Can I respond since I was mentioned?
Could I go? I haven't spoken yet.
Oh, by all means, I was just brought my name up.
Lori?
Your call. Thank you. I think that my lens on this is very simple, that this is about process and not content. That most of the numbers that we've heard have come from the single provider who would benefit the most from doing this. We haven't heard numbers from the provider that we have. The questions that have been asked and answered have all been done by the person that benefits to get the contract. There just should be competitive bidding, and that's what I think. I don't understand. We did a pay study ordinance. We did a Graysdale ordinance. We can't just go pick who we want to do it. And that's for much less money than we're talking about expending here. So that's why I support this. It's all about process. It's all about doing exactly what Lycoming County did, and that's it. It's not about killing healthcare, and I agree with what Mr. Heckman said. This is not a partisan issue. Healthcare is not, I wouldn't swing a cat, I'd throw a rock. But there's so many healthcare entities that don't have to be from the state of Pennsylvania, from the Lehigh Valley. Anybody could bid on this. And so I would just like to see some real comparisons before we agreed to go forward in any way, shape, or form with this. And I'm just tired of the false narratives, that's all. You know, like that there's, people are aligning, and that we don't care about employees, that we don't care about health. That's not it. That's not it at all. It's about the contract and the charter, and you know what, I agree. I think it's time to take a look at the charter. Because if there's so many holes that we're always going to be fighting about the process, because, you know, I do read it, I do look at it. Then if I don't have it right, then let's take a look at that next. That's all I have to say.
Can I respond to just,
Oh, yes, Mr. Ekman, you can respond.
my name has come up a few times. On the ordinance, I pointed out, not that it was necessarily a bad ordinance, I pointed out that the executive's responses, which in some cases I may agree with, I may not like his decision, but he has the power to make a decision. If the ordinance stays in effect, he may decide to say, well, you know what, fine, if that's what they want, and it'll help, I'll put it out to these other people, and they're going to see that they don't do as good a job, or they won't even want to come here. So it's not that I'm saying it doesn't mean anything. As I said, the last part, to me, is very important, that we're a pocketbook group, and I'm saying don't spend any money on this without council knowing. So overall, I'm not dissing the ordinance. I just question whether it'll do what the authors wanted it to do. But I don't see, my biggest thing is I don't see anything in the ordinance that kills it. And I think sometimes when a pitch is made, you got to be careful how the response comes out. I mean, you know, it's sort of like if I got the vaccine, one guy I know told me that I'm letting Bill Gates put nanoprobes in my blood. True statement. People tend not to take that seriously. Somebody says to me, if you don't quickly do this, you don't care about people's health or employee. That's silly. My record is very strong when it comes to employees. I'll be happy to share it, and it's in public record, and you can review it all you want. The other thing is the taxes. If we don't do this, taxes are going to go up. You know, during the Graysdale debate, I showed up as a private citizen. And I remember a councilman or two saying, if you keep Graysdale, taxes are going to go up 30%. Maybe Mr. Cusick remembers that. It'll go up 30%. Next, you're going to pay. I don't think taxes ever went up 30% after Graysdale. It just didn't happen. So I don't know, but we're a government. Do taxes go up? I mean, we did a tax cut. We've held the line. We've had a healthy fund. But a fact of life is we're very employee-driven. Human Services, for example, is very employee-driven. I've had people who've run for office and say, Ron, where can we save money in Human Services since we spend so much? Now, I didn't realize most of that's intergovernmental, but there's very little to cut. I mean, at the end of the day, it's all about staff. You've got to have the staff. We need the staff. People come in for services and prothonotary in places all the time. You can't have a computer kiosk remote. You need a staff. You need somebody to talk to. We're the government. And if one day, I don't want to have our people pay more. I don't want to have them pay any more than the going rate as far as a contribution, and less if possible. Would we ever have to raise taxes? If the prison gets overflowing or anything else, the courts add more people. Yeah, I mean, it's a cost of doing business. Most of you know, I was involved in, there's a cost to do business. Our cost to do business is primarily employees. If this company would come on board, and if they do what they're saying, if they can return $2, and I look at it as $2, not telling me people are going to be happier. People are happy if they want to be happy. What's the saying Henry Ford said? If you think you'll succeed, you will. If you don't think you succeed, you won't. So the thing is, it's all in your mind. It's what you think. And I hope they're successful. I'd like to see them save us money in healthcare. I wish they could give me some factual information from the other places. Just say, well, they kept us. If you hired somebody for a lot of money, you're not going to turn around in 2 years and say, that was a terrible investment, because this is a long-term investment. So I'm sure they would do well. They probably would save us some money. I still say their claims are bold. I've heard a lot of claims over the years. This is one of the bolder ones, but go bold or go home. So, I mean, I just want to say, my name was mentioned in that. I'm not saying it's a bad ordinance. I don't think it kills anything. I just told you my opinion on a few of the points of it, and I personally think if that's not necessary, we should probably move on.
Okay, Mr. Cusack?
Just real quickly, I'd like to thank Mr. Heckman for essentially following up with what I had mentioned. And again, I'll go back to section 1310 regarding non-competitive negotiations. It says this method should not be used to substitute for a competitive procedure if a competitive procedure can reasonably used. And I believe one could have reasonably been used, and certainly if it were here, I would have supported it. And I do believe we need good health care for our employees. And if this came through a competitive bid process, it'd probably have my support.
Even with yoga?
Even with yoga.
Sorry, I wasn't recognized.
Mr. Goffredo?
I don't want to take up too much more time on the topic either, but I don't want to make it seem like I'm completely 100% turned off to this. I think all of us have biases whenever anything gets rolled out. We do our best to push them to the side, listen to it reasonably, and make our judgment from there. Mr. Cusick asked for competitive bid, which I think would make everybody feel a little bit more comfortable with this. The one thing that I think would make me feel extremely comfortable with this is if somehow, through the negotiations, we can, we're talking about saving 20% on the low end of a projected $30 million budget item, that's $6 million. If they're so sure they're going to be able to save us money, why not put it in writing and base their fee off of their savings? They can save us the low end, we can give you 2%. If you get better than, if you get to the 1.8 number that they're saying that they can do 2.2, maybe we'll give you 5%. But let's not just take it at their word and then build a facility and buy x-ray machines and get pot committed into something in a subject that we really have no basis or no real history of experience in. We'd be looking like fools. And then if they came back and say, hey, it didn't work out, you're spending $6 million more this year, then we look like idiots. So if we can get into writing and they can guarantee their savings, I'd be an idiot not to accept it. But you said in the beginning when you first presented this, it's too good to be true. It is. I've never seen anything that's too good to be true. And this seems too good to be true, so everything's telling me to pump the brakes. But if they can put it into writing that they can guarantee savings in the first year, I wouldn't be objecting to it.
Nobody else? It's interesting to have to sit and listening to all of your opinions on this. And it's enlightening for me to absorb everything that you had to say. And I'm just going to finish up by saying this. I have no issue whatsoever with trying to give our employees the best health care that we possibly can. Not a problem at all. I have a huge fear. And Mr. McClure, you have stated to, and they have stated to us, that they will not be forced to take this if given to the employees. But you're not going to be here forever as the executive. Someone else could come in and say, you have to use this. And that bothers me. That is what really bothers me with this thing more than anything else. It is a beautiful plan. I mean, I'm listening to it. But in my heart of hearts, I have this fear that at some point, this is going to be shoved down the employee's throat, and that's a concern that I have, a real concern I have. Competitive bid, I would like to see that too. I'm not going to tell you I wouldn't. But in the long run, my biggest fear is that, I mean, I've listened to the plan. I'm impressed by what they want to do. But I have that knot in the side that's telling me somebody else is going to come here and do something when we're all gone. It's not going to be fair to the people that we cherish the most, and that's the employees of Northampton County. With that said, I'm going to call for the vote. A yay is to override. A nay is not to. Mr. Lembo, would you call for the vote, please?
Mr. Gofredo,
Yes.
Mr. Heckman,
Yes.
Mr. Lott,
No.
Mr. Myers,
Yes.
Ms. Fargo Hefner,
Yes.
Ms. Zirinsky,
No.
Mr. Brown,
Yes.
Mr. Kuzic,
Yes.
Mr. Giovanni.
Yes.
The ordinance is overridden by a vote of 7-2.
We will move on to the next thing. Consideration of a term sheet amendment for ASME District Council 88 Local 1265, residue court-related, non-professional court-appointed professional units. Mr. Heckman, please introduce the resolution, please.
Oh, okay. Thank you. Whereas at the meeting held December 1st, 2022, the Northampton County Council duly adopted the ordinance titled an ordinance regarding an employee health center. That's not it.
No, that's not it.
We don't want to do that again. All right. Whereas Northampton County Charter 202-12 provides that the county council shall have the power to approve any collective bargaining agreements with officers and employees. Whereas on December 28th, 2022, county council received a term sheet with amendments to the contract between Northampton County and the AFSCME District Council 88, Local 1265, residual court-related, non-professional, court-appointed non-professional units. Northampton County, you have Exhibit A. Now, therefore, it is hereby resolved by the Northampton County Council that the attached term sheet shall be approved this 5th day of January 2023. So moved.
Discussion by council. Mr. Cusack.
I'll start it off. First of all, congratulations. This is a good contract for the employees, since we were speaking about that. I guess my only question is, I see COLAs of 4.5, 4.5, and 2.5%. I guess the only thing that I would have asked is, given the size of these COLAs, was a step considered? Because I think the problem that we always wind up with is in 4 years, you're going to have people on the same step. And that's always something that is a concern of some of the more veteran employees.
Want an answer?
Sure.
Okay. Arm's length at the bargaining table, it was the COLA that was preferred by the unit.
There you go.
Well,
The steps, as I previously stated in public,
Yeah.
steps were offered.
okay. Well, if that's what they wanted. And the other question I had was the O&M employees at Graysdale. I see that we're offering them that retention and recruitment bonus. Will that be taken from the previous allocation that council did from the rescue plan?
We haven't decided yet, but it can be.
Okay.
Yeah. There's money there for that.
If I'm not mistaken, that money was coming out of that money anyway, wasn't it?
Well, I think he's saying, are we going to use that money? So we've added a new group of folks to that pool. And I think Mr. Cusic's saying, what pool of funds are you going to use to fund it? And I think we have enough in Graysdale to do that.
Okay.
Thank you, sir.
But we haven't made that decision yet.
Thank you.
Anybody else discussion? If not, call for a vote, please.
Mr. Heckman.
Yes.
Mr. Lott,
Yes.
Mr. Myers,
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Mr. Brown,
Yes.
Mr. Kuzic,
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Adopted by a vote of 9-0.
Mr. President, if you'd indulge me for a second, Dave Perry, who is with ASME 1265, is here, as is their business representative, Mr. Jim Irwin. And I just wanted to thank them for all the work they did with us at the bargaining table to get to a resolution for the largest collective unit that we have in Northampton County. And I
Thank you.
I appreciate them and wanted to thank them for their work.
Council thanks you, gentlemen.
Santa Claus Jr.
I didn't recognize Mr. Irwin with that beard. All right, we're going to move on. Consideration and application for acceptance of funds through COVID-19 American Rescue Plan Act Whole Home Repairs. Yeah, I know. Repairs Program Resolution. Mr. Rinsky, would you read that for me, please?
Now therefore be it resolved by the Council of Northampton County, Northampton County formally requests a grant in the amount of $2,277,659. DCED will be designated as the department to administer any funds received from the Whole Home Repairs Program. And 3, the county executive is authorized to execute any forms necessary to apply for and receive this funding.
Discussion?
Again, I would just ask if someone from Economic Development could tell us a little bit about this plan to enlighten some of our
Ms. Smith, would
bright
you
young
mind?
students.
Yeah,
Adam.
I didn't want to single that part out.
That's what I'm here for.
Who's eligible for this? What is this program about?
So this program is through the state. It is not a competitive grant. This is the allotment that the county is entitled to. It's very fluid at this moment, and that is the language that the state is using. So there's still a lot for us to work out internally. But basically, with the 2.2 million, there's buckets that we must allocate funding to, one of which is to create or implement, we'll have a grant program for homeowners where we can do those home repairs, and the other is for workforce development, to develop the workforce who can complete those construction-related repairs. So a lot to come yet. We're still getting all the detailed information, but I mean, the good news is we should have funding by the end of 2024. We have to obligate it. And then we've got up till 2026 to expend it. So thankfully, we've got a big window since there's still a lot of questions that we're waiting for answers on.
Including cap,
Excuse me.
how much they can get?
We're getting the
Yeah,
2.2.
but how much individually is that
Right,
gonna be
and
worked out?
that's
None of
yet
that's
all
been
to be, they've not put any caps, so we have to come up with the basic outline of the whole plan internally.
So if we're going to have to do that internally, are we going to bring council members in to help you do that?
Certainly can have that discussion.
Okay, Ms. Margaret Hefner?
So I have a question. This money is already being passed through another entity, or is this I'm not sure where this money's coming
It's
from.
coming from the state. And there's
this is
only
the
one
state-
applicant allowed for the whole county.
So we're accepting this money from the state.
Correct.
Are you done?
Yeah.
Tara?
Thank you.
I'm sorry, Ms. Zirinsky.
Thank you. It's my understanding that this was like Nikhil Saval's bill, am I correct, from the Senate?
I don't
He
know.
promoted-
I don't
'cause he
know
came
who
to
sponsored the bill.
Allentown. Oh, okay. Well, I was at the press conference where he presented this, and I'm pretty sure it's the same one. But it's my understanding that this money can also be used for renters who are in need of home repairs if they go through their landlords. Is that correct?
The
It's not just-
the landlords would be eligible, but it wouldn't be a grant, it would become a loan program.
Oh, okay. So would this money be available to landlords then through this program? Or are we designating it only to homeowners?
And we've not fully determined the guidelines yet. We've had discussions. We're not certain that we're going to get as much bang for our buck, if you will, if we do the renting component, simply because of the cap that we've got. We're getting this 2.2, but by the time we take money out for administration and professional fees and all the other things, realistically, we're going to have, 1.9 out of the 2.2 or less to put into these two buckets. So
Wow. So I imagine.
still a lot to work out.
Sure. So I imagine, though, if somebody is going to get a portion of this grant, they would have to show that the work is done first, or they have to present receipts of some sort, and then they are reimbursed?
Correct, it would be
Correct.
reimbursement, yes.
Okay, great.
And they would have to meet the eligible criteria, it's low to moderate income. There's the income level
Right.
guidelines, yes.
Okay. All right, excellent, thank you so much.
Sure.
Is there anybody else? Call for the vote, please.
Ms. Zirinsky.
Yes.
Mr. Lot.
Did we lose him?
Kevin?
Yes.
Okay.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Giovanni.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Adopted by a vote of 9-0.
Consideration of a Pennsylvania Act 106 compliance resolution, appointment of risk manager, form content, appointment of a risk manager. Mr. Giovanni, would you please introduce this for me?
Yes, I will.
Everybody gets a little action tonight.
Okay.
Therefore, it be hereby resolved that the county shall hereby adopt the following procedure for compliance with the provisions of the act. County council is designating the director of the Department of Administration or his or her designee to serve as the risk manager for the purpose of this act. The director of administration or his or her designee is hereby designated to compile and submit information to the county council prior to the close of every calendar year as to the amount of the security that the risk manager recommends that the county maintains during the succeeding year, and otherwise to provide the information as set forth below to enable county council to place into force the bond and insurance required by the act for this succeeding year. Number 3, in the course of performing the duties assigned under above, the Department of Administration and the solicitor shall confer to determine the form and content of the bond and insurance would comply with the provisions of the act. Number 4, at least 2 weeks prior to the close of every calendar year, the Department of Administration shall present to the county council for its consideration and approval the form and the amount of the required security, together with a recommendation as to the bond or policy satisfying the criteria set forth in the act.
Discussion by council? Yes, Mr. Kuzic.
As I've asked in the past, I see our Director of Administration is here. He would be kind enough as to explain to what a risk manager is to our young students of government. We'd appreciate it.
More teachable moments.
Good evening, council. In that extent, we assess what necessities we have for both insurance, bonding, so that any activities, whether they be criminal or misguided efforts, are properly insured so that the citizens are not left on the hook for those items, not the least of which making sure that our facilities are maintained, are kept safe, that we take every effort to make sure that health, safety, and welfare of people visiting as well as working here is kept to the highest degree so that our claims are very low.
Thank you.
Anybody else? Call for the vote, please.
Mr. Giovanni.
Yes.
Mr. Myers.
Yes.
Ms. Fargo Hefner.
Yes.
Ms. Zirinsky.
Yes.
Mr. Brown.
Yes.
Mr. Kuzic.
Yes.
Mr. Gofredo.
Yes.
Mr. Heckman.
Yes.
Mr. Lot.
Yes.
Adopted by a vote of 9-0.
Form of content. Mr. Kuzic, you want to read that?
Sure. Now therefore, it is hereby resolved that the county shall hereby accept the following level of security to cover public officials, including members of county council and the county executive. 1, crime coverage through the county's insurance policy with P Corp, which covers all county officials and employees for fraud, embezzlement, theft, forgery, and other criminal acts up to $1 million per occurrence. 2, a wire transfer bond in the amount of $4 million, which provides additional security above the maximum $1 million crime coverage under P Corp for certain county employees authorized to initiate wire transfers. 3, a treasurer's bond in the amount of $72,000, which is coverage required by the state based on revenue collection levels and is still required since Act 106 does not apply to county treasurers acting as tax collectors as provided in Section 4 of the local tax collection law. 4, a magisterial district justice bond in the amount of $55,000 per magisterial district justice, since Act 106 does not apply to those officials.
Discussion? Call for the vote, please.
Mr. Kuzic?
Yes.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Brown?
Yes.
Mr. Giovanni?
Yes.
Mr. Gofredo?
Yes.
Mr. Heckman?
Yes.
Mr. Lot?
Yes.
Mr. Myers?
Yes.
Adopted by a vote of 9-0.
Consideration for a resolution accepting donation from Graysdale for our Military Order of the Purple Heart, Lehigh Valley Chapter. Ms. Hefner, would you do that?
Whereas Northampton County Home Rule Charter, Section 202, provides that the county council shall have, among others, the following powers: to accept on behalf of the county any gifts of real property, and to provide for the acceptance by an agency on behalf of the county of other gifts. And whereas the Military Order of the Purple Heart, Lehigh Valley Chapter 190 has donated $1,080 to be divided and split equally among all veteran personal fund accounts. And whereas an anonymous donor has provided a donation of 25 weighted stuffed animals to be used for the purpose of comforting residents valued at $1,092, therefore be it resolved that Northampton County Council, that it does hereby authorize the county executive to accept on behalf of that Graysdale the above-mentioned donations.
Discussion?
Thank you. Thank you to them for the donation.
Yeah.
Vote, please. Call for the vote.
Ms. Fargo Hefner?
Yes.
Ms. Zirinsky?
Yes.
Mr. Brown?
Yes.
Mr. Kuzic?
Yes.
Mr. Giovanni?
Yes.
Mr. Gofredo? Mr. Heckman?
Yes.
Mr. Lot?
Kevin?
Mr. Lot?
Yes. Yes.
Mr. Myers?
Yes.
Adopted by a vote of 9-0.
Is there any other new business we'd like to discuss? If not, council committee reports. We don't have any, as we are in the process of finalizing some of the committees. As it stands right now, we need liaisons for Conservation District, Farmland Preservation, Graysdale Advisory Board, Industrial Development Authority. Think about any of those that you'd like to, and please respond back to me or Ms. Lembo so we can fill those positions if anybody is interested.
Did you just call for liaison reports?
No, not liaison reports. There's
Oh.
liaisons that are not filled.
Right, sorry. I heard.
Okay? I was asking for that right there.
Right.
I asked for council committee reports. Okay, now council liaison reports.
So I have a report from Farmland. They met on the 4th. Yeah, so their nominations for chair: Chris Amato is the new chair, Terry Cromer is the vice chair. Right now, the status is 245 farms preserved at the end of 2022 at 18,838 acres. There were 23 applications with potential for 1,085 acres for next year. So that's pretty exciting. And I've had a really great experience on farmland preservation as the liaison. I really appreciate the time that I got to learn more about farmland preservation and to interact with the farmers. I have decided that I'm going to back down and allow someone else to take that spot so that maybe they can learn more about farmland preservation and be part of that. I have a lot on my plate right now, and I just want to say thank you to Maria and Ryan and that whole board for making somebody who doesn't own a farm feel welcome.
I want to thank you for your service and the times you put there. You're working on year 6 doing this, so congratulations, doing a fine job with that.
Thank you.
Council clerk report. Nothing. Solicitors report. Nothing. Anybody got anything for the good of the order? Before we adjourn, I would like to take the moment to thank all of you for being here tonight, participating in, which is my first meeting as president of this organization, proud to be it. But I must say before we go, I'd like to take a moment and everyone take a moment and take a prayer and think about that young man and all those people who are suffering and may not be able to deal with life at this point. And let's hope for better health in 2023 for everybody else. With that said, I'd like to ask for an adjournment.
Motion.
Second,
I'll second.
call for a voice of acclamation, folks. All those in favor say aye.
Aye.
I will see you in 2 weeks. Come on around, get your signatures back. Where are you guys?